Dr. Smith, physical therapist here, and today I'm going to be talking about home healthcare physical therapy salaries. Now, over the past few weeks, we've seen multiple salary reports come out from either Ben Fung and Updoc Media or Covalent Careers, where there's multiple self-reported data points by practicing PTs reporting their pay in their respective settings. Now, with all the new graduates coming out this time of year and those that just passed boards, this is very important to a whole lot of PTs about to join the workforce. And it may be important to you as well if you're considering changing settings to get paid a bit more money. Now, as far as home care is concerned, I've seen on average, and let me step back here, I review probably about 25 to 30 employment contracts a week for home care therapists to make sure they're getting paid their worth. And on average, it still is around $100,000 as of July and August 2019. Now, if you Google it, just like if you Google average PT pay, they say $80,000. Some areas are going to say no way. Some areas are going to say that's way too low. If you Google home care, it's going to say 77 to 119,000. On average, what I'm seeing, regardless of experience, is around $100,000. Now, the lowest I've seen for a new graduate in a popular metro area was 80,000, but that was just the base pay. It didn't include mileage, compensation, and so on. So it was around a $90,000 pay package. However, after we did some negotiation, we got them up to 100,000. And then the highest I've seen has been 138,000. And I've seen that two times. One was for a new graduate with no experience in the rural area, and the other one was for somebody that had 1 year of outpatient experience transitioning to home health that had multiple board certifications. And again, it was rural, so that's probably why they were paying as much. Again, though, I've seen clinicians with years of experience only getting 90,000 because they don't know how much the license bills, or they don't realize to ask for a raise with the cost of inflation. So on average, though, for new graduating physical therapists or those transitioning to the setting, I've seen on average around $100,000, and that's just the base pay. So when I'm saying $100,000, that's not everything. That's the base pay. Then we add in the mileage, the compensation, the benefits, reimbursement, CEUs, and so on. And usually we're left with about $105,000 to $120,000 pay package on average, but with the base pay being around $100,000. And that's as August and July 2019. Now, you may have heard there's no such thing as a six-figure job in home care or a six-figure job in PT. Those people probably never worked home care. They probably never had a six-figure job, and they probably don't think it's possible, or they just, they haven't experienced it themselves. I know lots of new graduates that reach out to me are like, oh, my professor told me not to do home care. Well, it's like, hey, buddy, you want to make more money than your professor? Go ahead and do home care. That's just the reality of the situation. Again, I'm not telling you to work home care because it pays more. My personal opinion is that you need to make as much money as you can so you can funnel that into side hustles, funnel that into stocks or bonds, funnel that into whatever you want, put a vacation fund away. But it's nice to have, an emergency fund saved, other money spent up. And then if you want to go spend money on like a mastermind course or something like that, which, that's on you, you can do that without digging into your emergency fund or other things like that. So again, remember, my goal is to get you paid as much as you can and paid reasonably. And in this setting, which I've kind of learned to specialize in, it is crucial to get close to that six-figure mark, because once you get there, it's much harder for people to poach you, number one. Number two, if someone does try to poach you, they're gonna have to offer you more money, so you're gonna get paid more. And again, the higher you start, the higher your glass ceiling is. If you start at 60, your glass ceiling is maybe 70 in 10 years. You start at 100, your glass ceiling is 110, 120, but it's still a lot more money over the course of a lifetime. Now, the only times I have not recommended going for around 90 to 100 is if you're going to do a staffing company. This may be your maybe out of necessity in a highly saturated area just to break into the industry, and because of that, you may take a little bit of pay cut just breaking the industry. But this also goes into part two, where if you're going to quit that job early, leave that job, or so on, then yeah, just do it for a pay cut and then quit that job early, especially as a new graduate, especially if it sucks, because you're going to shed your new gradness when you start somewhere else or do travel or whatever. You're going to be able to talk about working at a prior place. Of course, keep those good connections if it's a good environment and so on. Don't try to burn all your bridges unless you want to. But what I'm trying to say is if you quit that first job early, it sheds your new gradness pretty fast, because you can talk about working somewhere else for a while. Even if it's a few months, you work there, you worked as a practicing clinician, it sheds your new gradness. Now, if you have an awesome job and you get paid six figures right out of school, which I've seen happen, then no, don't quit that job early, because you're already getting paid pretty well. So those are really my points for this video. The third thing I'm gonna say is travel, home health. Travel, home health, I've seen lots of people get lowballed, especially around graduation MPTE season. Travelers or new grad travelers, people are gonna try to take advantage of you. At CSM is when they get your contact info, and then once you graduate and pass your boards, travel companies, a lot of them, if you don't have a good recruiter, are gonna try to take advantage of you, try to lowball you. I've seen some home health PTs get $1,200 in rural Texas when the PTA is getting $1,500. And I've seen another PT know their contract in that same area where they were able to get $2,400. And I've also seen multiple contracts in California at $2,400 plus a week. So if you're gonna travel, you can make a lot of money in the home health as well. But on average, in my experience from the contracts I've reviewed, it's around 100 for a full-time job. And if you're gonna do travel, it's probably 100 to 120 because you're gonna be at the $2,400 a week, especially if you have the tax home in your tax situation. But hopefully this video helped you guys with home health salaries. And again, like I said, there is six-figure jobs in home health. I've made a lot of money pretty fast out of school. I'm currently got an offer for $125,000, and I've been making over $100,000 for about a year now. So just, you know, I graduated last May. It's not hard. Just be proficient, know your worth, know the new payment models, and what's gonna happen is we may see some job offers be a little bit lower right now as the payment models come into effect for PDPM and SNFs and PDGM and home health, but the market's gonna correct itself. As long as you keep providing value and show agencies you provide value, show your patients, your clients you provide value, you're gonna be okay in the home care setting. Again, before we were based on reimbursement, but now with the new case mix, you can go look at my PDGM video on case mixes where even low priority referrals, you're still generating around $1,700 per 30 days for that patient. So, you know, you see one patient for a whole cert period, you just made that agency $3,400 on the low end, but most of these patients are gonna have nursing comorbidities and other stuff going on there. These patients are actually probably gonna be generating around $7,000 when you factor in the diabetes, the endocrine, and all of that. So hopefully this video made sense. If you have any questions, reach out to me. And again, I just wanted to put out this information because everyone says, oh, you can't do this. You're a new grad. When I was in school, somebody told me I wouldn't be making more than $65,000 out of school. It's all BS. It's all relative. Know your worth, get paid your worth. Remember your license bill is the same. And if you're gonna try to deal with somebody that's like, oh, you're a new graduate or you don't have 27 years of experience, you probably don't wanna work there anyway. And what you'll see with these new models coming out, these older models of care, these companies are gonna be the ones that are hurt the most and probably go out of business. All right, guys, thank you for watching.